Movement Terminology and Biomechanical Principles Lecture 1 Drive. Movement Terminology and Biomechanical Principles Lecture 1 Dr. Julie Saji. Quantitative Analysis. Biomechanics. Kinematics. Kinetics. Qualitative Analysis. Naming and evaluating. Movement components. Quantitative analysis. Counting and measuring. Movement component. Statics. Study of body in state of rest. Dynamics. Study of body in state of motion. What is kinesiology? Key middle dot knee middle dot c middle dot hole middle dot ho middle dot gn. Greek kinesis, movement, logi, science of the study of the anatomy, physiology, and mechanics of body movement, especially in humans. American Heritage Dictionary. The branch of physiology that studies the mechanics and anatomy in relation to human movement. Merriam-Webster's Medical Dictionary. The study of muscular movement, especially the mechanics of human motion. Steedman's Medical Dictionary. Kinesiology. A sound understanding of kinesiology allows for the development of a rational evaluation, a precise diagnosis, and an effective treatment of musculoskeletal disorders, and allows for safe, appropriate exercise prescription. The study of kinesiology borrows heavily from the sciences of anatomy, biomechanics, and physiology. Anatomy, the science of the shape and structure of the human body and its parts. Biomechanics, a discipline that uses principles of physics to quantitatively study how forces interact with the living body. Physiology, the biologic study of living organism. Kinematics. Kinematics is a branch of mechanics that describes the motion of a body without regard to the forces or torques causing the motion, for example velocities and accelerations. There are two types of kinematics: qualitative and quantitative analysis. Qualitative analysis deals with naming and evaluating movement component. Quantitative analysis is concerned with counting and measuring movement component, for example time and weight. Kinetics. Kinetics is a branch of mechanics that describes the effect of forces on the body. There are two types of kinetics: are statics and dynamics. Statics is the study of bodies remaining at rest or in equilibrium brought about by balanced forces. Dynamics is the study of moving bodies under the effect of unbalanced forces. Kinesiology terminology. There are two general types of motions that occur within joints of the human body. Translation, linear motion in which all parts of a rigid body move parallel to and in the same direction as every other part of the body, can occur in either a straight line or a curved line. Rotation, motion in which an assumed rigid body moves in a circular path about some pivot point. All points in the body simultaneously rotate in the same angular direction. Active movement, movement of a body, movement of a bone at a joint, that is caused by muscular contraction. Passive movement, movement of a body caused by sources other than muscular contraction, i.e. an outside push or pull, gravity, etc. Reference position. Anatomical position equals person standing upright, facing straight ahead, feet parallel and close, and palms facing forward. Fundamental position equals palms facing the body. Planes of motion. Osteokinematics describes the motion of bones relative to the three cardinal planes of the body: sagittal, frontal, and horizontal. The sagittal plane runs parallel to the sagittal suture of the skull, dividing the body into right and lieutenant sections. The frontal plane runs parallel to coronal suture of the skull, dividing the body into front and back sections. The horizontal, transverse, plane courses parallel to the horizon and divides the body into upper and lower sections. Cardinal planes of motion. Most human movements take place in multiple planes. Although each specific joint movement can be classified as being in one of the three planes of motion, our movements are usually not totally in one specific plane but occur as a combination of motions in more than one plane, which is often called a diagonal plane. Axes of rotation. Bones rotate about a joint in a plane that is perpendicular to an axis of rotation. The shoulder, for example, allows movement in all three planes and, therefore, has three axes of rotation. Axis of rotation equals the axis which has a 90 degrees relationship to the plane of motion and around which the movement takes place. Three types are sagittal, frontal and vertical axes. Osteokinematics, a matter of perspective. Movement of a joint can be considered from the perspective of either the proximal, close, segment or the distal, further, segment. Femoral on pelvic motion. The proximal segment can rotate around the distal segment when the distal segment is the relatively stable segment. Likewise, the distal segment can also rotate around the proximal segment when the proximal segment is the relatively stable segment. Pelvic on femoral motion, directional terms. Arthrokinematics, typical joint morphology. Arthrokinematics, the motion that occurs between the articular surfaces of a joint. Arthrokinematics is largely dependent on the shape of the joint structures, shape of the bones within a joint. Arthrokinematic principles of movement. Convex surface on a concave, convex rolls and slides in the opposite direction. Concave surface on convex, concave member rolls and slides in similar directions. Movements in joints. There are three fundamental movements that occur within a joint. Roll, multiple points along one rotating articular surface contact multiple points on another articular surface. Slide, a single point on one articular surface contacts multiple points on another articular surface. Spin, a single point on one articular surface rotates on a single point on another articular surface.